So 5 years ago, I was sitting in Emory School of Medicine. I was about to graduate from nurse practitioner school, and I was working with fourth-year medical students. The cool thing about Emory University is the School of Medicine and the School of Nursing collaborate for one interprofessional seminar before we all graduate. I had been working in the ICU for 2 years. I was pretty down on this seminar. I felt I needed to be studying for boards or finishing up my clinical. I knew how to talk with my physician colleagues, and I knew how to work as a team. But I also wanted to graduate, so I went to the seminar. I made some friends, and I learned some things. Fast forward 5 years. I now work in an academic medical center, and I work with 2 physician APRN teams. One focuses on multiple sclerosis, the other on headache. We work seamlessly, promoting patient access and quality care. These teams are the new face of healthcare. What we've proven is that we're going to decrease cost or be cost effective. We're going to improve quality, and we're also going to improve patient satisfaction. So how do we do this? We focus on these teams based on wonderful communication. So during this presentation, we're going to talk about how do you get to this level of communication on these teams, how do you provide quality and how do you measure it, and how do you improve patient satisfaction, all while preserving cost. And I'm also going to talk about what an APP is and what we do. So first off, APPs are nurse practitioners and physician assistants. We all have master's degrees and some of us have doctoral degrees. We all are trained as generalists. We don't have residencies and we're not subspecialty trained. We all have to pass board certifications. The important thing to remember is when you're hiring an APP is that they do need continued training. They need time to kind of rev up their practice and understand what's going on. As the need for advanced practice providers continue, we do see residencies popping up throughout the country. This is very exciting to me because these residencies are promoting an expanded care that we know is needed as healthcare changes. So now you've got your APP, you're going to implement this team approach. So how do you do it and how is it going to be successful? We feel that in the new world of healthcare, quality plus patient satisfaction over cost is how you're going to make this happen. You're going to promote quality and patient satisfaction while not altering your costs and hopefully saving money. So how do APRNs improve quality? Medicare, Medicaid has released PQRS standards. We know these are important and we hope that they actually measure quality. That's their goal. And we have to make sure that we're meeting these measures to get adequate reimbursement or to make sure we're getting total reimbursement. When I first came to Emory Healthcare, there was an issue with this. The interesting thing is with electronic medical records, you can attach education materials to your document, and that's a PQRS measure, making sure that your patients are getting this education before they leave clinic. That wasn't happening. As a nurse, I'm all about the education. It's what I love. It's my bread and butter. So I had already made these nice little education templates. And the cool thing about our system is you have templates, but you can create your own. You can do multiple different things with your templates. And they're saved. So I have a migraine visit with saved template education. It was easy to instruct my colleagues on how to do that, and that was a simple fix. The other things that nurse practitioners and physician assistants are doing is we're able to improve testing over the continuum. When you look at cardiology, endocrinology, primary care, and you look at diabetes, hemoglobin A1C measures, and hypertension measures, these patients are being managed by APPs, and they're doing well. We're measuring quality with these measures, and we're doing it very well. So patient satisfaction, how do we improve patient satisfaction? When you think about access in neurology right now, most of you probably want to frown. It's not good. There is a huge bottleneck to get patients in to be seen. And those patients are very complex. Nurse practitioners and physician assistants, APPs, can help by seeing those patients in follow-up, seeing new patient visits, and decreasing that bottleneck to get into a provider. The other thing that they can do to improve patient satisfaction is decrease the burden of this new healthcare model and the improved access. I don't know about you all, but my patients can email me, they can portal me, they can call me. They have multiple different ways to communicate with me, and we get hundreds of messages in our clinical pools a day. These messages can be managed in a team-based approach where you're taking some and sharing them and getting them done, usually with a nurse, but a lot of them are very complicated and they need provider attention. So by getting a patient in quickly, allowing them to be seen within a reasonable time period, and also answering their questions quickly, you're improving patient satisfaction. So you've hit two of those markers. Now when we think about cost, that's kind of a hot topic right now. And you look at states that have allowed full scope of practice. So APRNs, APPs, they're functioning at a full scope of practice and they're able to do this autonomously. We've looked at cost in these states and we noticed that cost initially increases, which is associated with the increased access. Patients have quicker visits, they're able to get into the doctor's office sooner, they're able to see a provider quicker and in less time intervals. When you look at that model, though, over time, cost actually decreases because you're decreasing hospital admissions. You're able to follow chronic conditions in the outpatient setting without having to admit them to the hospital. You're able to decrease emergency department visits because you're able to see patients in clinic. These are all things that the APP does to improve cost. So we've got our quality because we're able to affect PQRS measures, our satisfaction because we're decreasing this burden, and we're all reducing cost by access and less hospital admissions. Oops. So putting it all together. So how do you create this team? How do you create this seamless team, this dynamic team that's able to see patients effectively, able to reduce cost, able to improve satisfaction? You have to think about communication, and you have to know each other's biases, you have to know learning defects that exist, and you have to have trust in each other as this team. A few weeks ago, I had this tough situation in clinic. I had an orthopedic surgeon call me about a patient with known cervical stenosis, and he was getting weaker and weaker. However, his MRI hadn't changed. The orthopedic surgeon was not interested in doing anything because the MRI was stable and he wanted neurology to see him because he was rather concerned. I had already kind of put into my head what I was going to do with this patient and what I thought he needed done. But I wanted to talk with my attending, and I wanted my attending to see this patient to make sure we were on the right track because I'm getting this terrible report from this surgeon. So I call him, and he is more than happy to help me with this. The next day I see the patient in clinic, do my exam, and my plan is relatively the same without any changes. The physician comes in, does his exam, and agrees with me. This is important in two ways. It builds his trust that I'm able to examine a patient and come up with a good plan of care, and it increases my trust that he's got my back, and if there's a problem, we're going to work as a team. So when you're able to function seamlessly, when you're able to do these types of things, you're always keeping the family and the patient at the center of the care, you're communicating, you're reducing cost, you're improving satisfaction, and you're promoting quality. This is why we need better interprofessional teams, and this is a model of care as we move forward into a new world of healthcare that is going to be essential and needed. So when I look back 5 years ago and think about myself complaining and moaning and groaning about having to go to this seminar, I think I probably missed out on much more information that I could have absorbed. And now I tell my students to relish that day, to really enjoy it and soak up everything they can. Because that culture, which I am so grateful for at Emory Healthcare, that culture of interprofessional collaboration is promoted in us in school and carried throughout our careers. So thank you guys so much.